The Doc is In is sponsored by Amada Senior Care.
7:26, and we're happy to have Fox 56 News Chief Medical Contributor Dr. Ryan Stanton with us in studio this morning.
Today, he's talking about a certain type of prescription that might not be as helpful as people think.
No, and unfortunately people like to get prescriptions, but sometimes those prescriptions don't need to be filled. So let's talk about it. Antibiotics are a scientific breakthrough that have saved hundreds of millions of lives over the decades and one of the best treatments against bacterial infections. That's important, bacterial. However, I often, when I'm working in the emergency department, I'll have patients come in with infections that are clearly consistent with viral respiratory infections or other viral syndromes, and others which antibiotics are not indicated. I'll note the patient is on an antibiotic for the viral illness, and when asked, they say they're written just in case. The assumption then is just in case this infection is bacterial. It decreases risk mainly to the provider. Unfortunately, antibiotics are not risk-free, and our immune systems are pretty amazing most of the time. Here are a few things that to keep in mind with regard to antibiotic stewardship and what happens when we take them for viral infections. Taking an antibiotic for a viral infection won't cure the infection. That's important to remember. Won't keep other people from getting sick because you still spread it, won't help you or your child feel better, may cause needless or harmless side effects, and promotes antibiotic resistance. The key is that if you hear the term just in case, inquire as to the bacteria being addressed. Unless there's a scientific risk, a significant risk, or bacterial source is likely, you should focus more on symptom management, thus feeling better. Coming up in the next hour, we're going to talk a little bit more about exactly what's going to happen if you take those antibiotics over time. May not be just to you, more societal risk to it, though.
So what would you recommend if it's more viral and not bacterial to feel better?
So it really is about what specific symptoms you're treating, right? Is the congestion, is the runny nose, is the cough, whatever it may be, the muscle aches, the fever. It is really about there's medicines out there that are going to help you feel better. And that's what people really want, is to feel better, not necessarily cure it. Your body's going to take care of the virus on its own.
And I think a lot of people think a lot of times, oh, you take the antibiotic, it'll happen quicker than having to kind of drudge it out a little bit with some of those other methods. But
exactly,
what
the
you're saying
timing is
is
just
don't
about
do
the
it.
same, 5 to 7 days for most viruses, so keep that in mind. That happens to be how long most antibiotics are as well.